So, good afternoon, everybody, and it's a great pleasure to have you here with us this afternoon. And I am with two beautiful ladies, Paloma Remior and Alba Martín from CERMAS in Madrid, Spain, and Dr. Bastian Schmack from Hannover Medical Center. We are here to talk about a little bit the retention implementation in your clinical sites and to have the views of you doctors in the different contexts also in one country coming from, let's say, the south of Europe, while the other one from more the northern part of Europe. So what does it mean for your clinical organization implementing a solutions like the one proposed by the retention project, and which kind of patients are you addressing in your clinical centers? Maybe we can start with Paloma about CERMAS.
So in our hospital, I think it's a must. I mean, it's needed, this solution, because we need to implement technology in our patients. I think it can improve their management, and also they can be more aware of their disease. And this group, in my case, we're gonna try to include patients just with PADs, with device, left ventricular assisted device, and heart failure, because we don't have heart transplantation patients. So that's our goal, to include this type of patients.
Well, Bastian, do you have patients that are transplanted in your hospital?
Yeah, sure. We at the medical school we are running overall the largest solid organ transplant hospital in Germany. We are running a quite fruitful heart transplant program too. We're also running quite a huge durable Albert in that program. So we are seeing the high demand in increasing the quality of ambulatory care.
Thank you. And Paloma, in your role of medical doctor and following, I suppose, a number of patients within your clinic, your organization, how do you think these patients can accept, let's say, a solution like the one proposed by these projects, which foreseen also wearable devices that should be weared by the patients? Do you think they are pretty much keen to it, or there are some issues related?
At the beginning, they feel like a bit overwhelming because there are too many devices and many of them think that they are not doing well or they cannot manage with that, and too many devices to take home, etc. But then you explain the whole issue, the platform. It has a kind interface for them, and they manage to understand it. And then when they get used to it, they feel like more controlled. They feel they take more self-care of their illness, of their clinical status. So they feel like more confident, more understanding of their illness. And I think it's a good thing for them as well.
So they feel more cared.
Yeah, more implicated and more cared.
More cared. Yeah. Okay, that's good. And what about the professionals feeling about it? Bastian, for example, you are a surgeon, and how much you embrace this concept of technological support also to the decision making, I suppose, and implementation of medical practice overall?
Well, we are actually facing a growing number of patients in destination therapy, especially in the heart treatment. So we have to understand that for the shortage of organ donation and those who are ineligible for transplantation and foreseen to have a destination therapy, but these patients will be on treatment, on support for years. So the adherence to the treatment is super important. So we do believe that implementing this retention treatment will result in a significant decrease in hospitalization rates. So the quality of life and the therefore the adherence on their treatment will rise.
So, being on the other side, let's say, as I said, as a medical doctor, how much you feel supported by technological solutions like the one proposed here? This is for Paloma.
Yeah, so I think that's the future. I mean, AI is already here, and we have to reskill ourselves and be more aware of what different devices do we have, and we can trust them. Also, they can do our job for us sometimes, and we can use that information to prevent and also to help these patients to take care even from home. I mean, just make them a call or instead of coming to the hospital. So I think for us at the beginning it's gonna be tough because we're gonna have more work to do.
Mm-hmm.
But at the end, it will help us to be more efficient and to have a better care of the patients.
Thank you. So it's a sort of a learning curve for both the professionals and the patients, and that's for the three of you. What do you think can really help uptaking these solutions and I mean maybe more communication about the benefits in following such this kind of approaches, or I don't know, also training and education to both medical doctors and patients. A word, I mean, a thought from each of you.
Well, from my point of view, is like Paloma said before, this is going to be the future. I mean, overall, and I think that we really need to get used to it because it's gonna be a more efficient medicine. We could take an advantage on the disease, on the progression of the disease, and in the end of all, the survival rates could improve if all of this telemedicine is doing properly in the future.
Bastian.
Well, actually, we are surrounded by information technologies day in day out, and those patients who are in heart failure, whether they are chronic heart failure or they're post-transplant or they're post-Alba implantation, they are on a journey, and this journey will most likely take years. And as my two colleagues always mentioned, we are probably are in need for some clever solutions to help us. And I feel, and I'm convinced that the retention project is one of these major game-changing supportive devices or concepts to help us cope the rising numbers of patients who are in need of heart therapy like we do, transplant blood and those who are chronically heart failure patients.
Another fact that I would like to highlight is the issue that, I mean, we measure when we see patients, we measure like blood pressure or heart rate, but there are some measurements that we don't take into account, like sleep, how do they sleep, or the humidity that are gonna parameters that we are gonna measure with this project, that maybe they will have some results, surprising results that we have to pay attention to. So
Okay.
I think it's a good way also to study this point of view.
How, and that's the last question for all of you. How huge is the problem, the health problem related to heart failure? Is really a sort of a pandemic right now? Because I heard some professionals saying we got more and more, a growing number of patients during the year. So which is the magnitude really of this medical problem that you are addressing, and hopefully with the support of retention you will addressing better, you will be addressing it in a better way?
I think that's probably it is one major issue in healthcare nowadays. We are spending 10,000 euros for each patient every year in the treatment of heart failure. Demographically, we will see more and more patients in need for this kind of therapy. So I don't want to use the word pandemic because it was overused over the last years already.
Sure.
But it is a burden. That's for sure.
Yeah, that's true. And with projects like that, the amount of cost and economic cost that it means to the health system, the different health systems, that is really huge. It's hospitalization, it's a visit to emergency rooms, and this could help to diminish this cost already.
Yeah, like simple measures as taking vital signs at home, we will prevent these events to happen. And also it's like a growing disease, a burden, as you said, because people is aging. I mean, we have improved in terms of preventing medicine, but still there are a lot of people with these problems that we have to take care of.
Finally, I think it's overdue. So we have not developed in telemedicine that much over the last decade. If you compare it to all the other IT developments that we are seeing all day. So I think it is more than overdue to have a supportive technology for us, especially in the field of health.
Thank you so much. Thank you.
Thank you.
Thank you.